Hello everyone and welcome back. I'm Dr. Anim. Today we're talking about a condition that is becoming much more common, diabetes in pregnancy. Think of your body as a car and glucose or sugar as the fuel. Insulin is the key that unlocks your cells so the fuel can get in. In diabetes, the key either doesn't work or you don't have enough of them. This leaves the sugar stuck in your blood instead of fueling your body. There are 3 ways diabetes can play a role in your pregnancy. First is type 1. Your body makes no insulin. You must use insulin injections. Second is type 2. Your body doesn't use insulin well. This is often managed with lifestyle or pills. And third is gestational diabetes or GDM. This is unique. It's diabetes that is discovered for the first time during pregnancy. So why does gestational diabetes happen? During pregnancy, the placenta produces hormones to help the baby grow. These hormones naturally make your body more resistant to insulin. Usually your pancreas just works harder to keep up. But if your pancreas can't produce enough extra keys to overcome that resistance, your blood sugar rises and GDM is diagnosed. Who is at higher risk? You have a greater chance of developing GDM if you were overweight before pregnancy, are over age 25. Have a family history of type 2 diabetes, have PCOS, or had GDM in a previous pregnancy. We usually test between 24 and 28 weeks because that's when those pregnancy hormones are at their peak. You'll take the oral glucose tolerance test, or OGT. You drink a sweet solution and we check your blood at specific intervals. A diagnosis is made if your fasting sugar is 5.1 or higher, your 1-hour sugar is 10.0 or higher, or your 2-hour sugar is 8.5 or higher. If your numbers are significantly higher than these, for example, a fasting sugar over 7.0, it's possible you actually had type 2 diabetes before you even got pregnant. If you already have type 1 or type 2 diabetes, planning is everything. A baby's organs form very early, often before you even know you're pregnant. There are 2 essentials. First, high-dose folic acid. You will need a higher prescription strength than standard vitamins, ideally starting 2 to 3 months before conception. Second is low-dose aspirin. Your doctor will likely start you on aspirin around week 12 to prevent high blood pressure or preeclampsia. The good news is most women can manage GDM with lifestyle alone. My favorite tip is the 15-minute rule. A simple 15-minute walk after every meal can drastically lower your post-meal sugar spikes. Also, focus on smart carbs. Switch to complex carbs like oats, brown rice, and plenty of fiber. But what if lifestyle isn't enough? Insulin is the gold standard because it does not cross the placenta. It stays with the mother and doesn't affect the baby directly. Metformin is another option. This is an oral pill. While it does cross the placenta, CURRENT studies show it is a safe and effective alternative for many women, especially those who cannot use needles. Your doctor will help choose the best option for you. GDM usually goes away the moment the placenta is delivered. But here is the catch. A shocking 50% of women with GDM develop type 2 diabetes within 10 years. Think of GDM as a stress test for your body. It's telling you that your body struggles with sugar under pressure. So what should you do? First, get a follow-up glucose test 6 to 12 weeks after delivery. Don't skip this. Second, get tested for diabetes every 1 to 3 years for life. Third, breastfeed if possible, as it helps process sugar better and lowers the risk for both you and your baby. Simple lifestyle changes like losing 5 to 7% of your body weight and exercising 150 minutes a week can reduce your future risk of type 2 diabetes by over 50%. GDM isn't a failure. It's a heads up. It's an opportunity to start healthy habits that will protect you and your family for years to come. Knowledge is power and you can change your future. If you found this helpful, hit the like button and subscribe to Health Made Simple. I'll see you in the next video. Stay healthy and stay informed.